Hi, my name is Jemima, and I will be presenting on my topic of choice was the hepatitis B virus. So I'm going to start with general information. Hepatitis B virus is one of the most common human viral infection in the world, and it specifically infects the liver cells that causes severe flu-like symptoms. There are different kind of hepatitis. So we have hepatitis A and E and other different stuff. Um, that's not included in this. Although most people with HPV can fully recover, about 5% remain infected throughout their lifetime, which makes them carriers of the disease and can easily infect other people. So hepatitis B can be chronic, which means it can last for up to 6 months, and some can also be treated and the symptoms will be gone, like it wouldn't be back. And most adults with hepatitis B can fully recover, but infants and children are most likely to often develop chronic long-lasting infection because of how small they are. HPV carriers have a greater risk of liver failure, liver cancer, or cirrhosis, which can permanently scar the liver. Vaccination can be used as a means of prevention when it comes to HPV, but there is no specific cure for the virus. Certain safety precautions can be taken to help prevent the spread of the virus to other people. Yeah. Symptoms of HPV. The signs and symptoms range from mild to severe, which can appear about like give and take 1 to 4 months after you have been exposed to the virus. You could also see them as early as 2 weeks post-infection. Everybody's different and everybody's signs and symptoms will be different too. Sometimes these symptoms are not guaranteed, especially in children of younger age, because how small they are, and sometimes children cannot tell what they're feeling and what is paining them and stuff. Okay. These signs are not limited, like the signs and symptoms of HPV are not limited to, but also include weakness and fatigue, loss of appetite, fever, joint pain, nausea and vomiting, darker colored urine, the white part of your eyes become yellow, like it's also known as the jaundice disease. And then I also stated that preventative treatment may reduce your risk of infection if gotten within 24 hours of exposure. So if you take like preventative steps, like if you go to the hospital within 24 hours, they can administer drugs to you to help like prevent the infection if it's within 24 hours. Causes of HPV. HPV can spread from person to person through semen, bodily fluid, or even through blood. Yeah, it can be spread through blood. Most common ways HPV spreads. Mother to child, which is like the most like common one, which an infected mother during childbirth, an infected mother can pass the virus to her baby. And then sexual contact. You can get hepatitis B when you have unprotected sex with an infected person. It can be passed through an infected person's saliva, semen, and vaginal secretion. So you always have to be protected. And it can also be passed through contaminated needles. It can be spread through contaminated syringes and needles from an infected person's blood. So, like people who work in healthcare, also kind of exposed to hepatitis B if they're not careful around sharp objects. If it's been in someone that has been exposed. Prevention. Like I said before, I'm gonna say it again. Hepatitis B does not have any cure. So there's no cure. Like whenever you start seeing symptoms and stuff, it doesn't have any cure. But vaccination is the best prevention, for hepatitis B virus. for the hepatitis B virus. This is typically given as the vaccine is typically given as 3 or 4 injections over the period of 6 months. The vaccine can be given to newborns, people who live with an infected HBV patient, healthcare workers, or those who come in contact with blood, like I said earlier in the previous post, people with multiple sexual partners, people with chronic liver diseases can also get the vaccine, and people with chronic liver diseases, I think I also mentioned that. People planning on going to areas, if you're planning on traveling to areas with high hepatitis B infection, you can always look online and it will tell you like places that are populated with the virus and stuff, and you can take the vaccine to prevent like getting infected. People with end-stage kidney diseases like are high-risk people who can also take the vaccine. Precaution steps to keep safe. Always wash your hands thoroughly with soap and water. I feel like we should all know this because of COVID right now. You should wash your hands for 60 seconds and thoroughly front and back, just trying to be safe and keep clean. Avoid direct contact with bodily fluids and blood just whenever you're around people who are infected. And use condoms when having sexual intercourse. Make sure to cover all cuts carefully. Whenever you're treating people with open wounds and stuff, try to be careful and take all precautions. Avoid sharing personal objects or sharp objects with others, like your razor, nail clippers, anything that would just cut in the skin and would have the virus sitting around it, toothbrush and other stuff. Make sure to use new and sterile needles for body piercings and tattoos. So if you're going to go get your body pierced and you're going to go get your ears, you're going to get your body pierced, or you're going to go get a tattoo, just make sure the person who is administering it is taking safety precautions and using clean, like make sure they open the stuff that they're using in front of you just to be safe and make sure it's new. Genetic makeup of hepatitis B. Hepatitis B virus, also known as HBV, is a pararetrovirus that infects hepatocytes. Hepatitis B virus has a morphology of a spherical double shell structure of about 42 millimeters in diameter, which consist of lipid envelopes containing HBAG that surrounds the inner nucleocapsides composed of hepatitis B core antigens. It is complex with virally encoded polymers and viral DNA genomes. And then I put what it looks like, the little tiny cell. It says the DNA, and it shows the E antigens, and just what it looks like as a tiny little thing. Microbes location in the body. These microbes can be found mainly in the liver because they attack liver cells, which lead to swelling, and they lead to swelling and over time development of scar tissues. This is also known as fibrosis. So fibrosis is as a result of scar tissues in the liver. Even though the liver can regenerate itself, as we know, like the liver regenerates itself, but with consistent and repeated injuries, new liver cells cannot regenerate fast enough, and the fibrous tissues remain as scars. The development of fibrosis causes the liver to become harder in texture. This hardening of the liver is also known as cirrhosis, like we said before. So people with cirrhosis have a greater risk of developing liver cancer. So basically what this is saying is just like the liver is overwhelmed from always, like, it cannot keep up with always regenerating itself every time it gets infected with hepatitis B. So it just, the regeneration process just kind of slows down and it stops, and the liver cannot protect itself anymore. So that's how it works. Geographical regions. According to CDC, hepatitis B virus can be found in nearly all parts of the world, but it's common in these areas. It can be found in, so it can be found in everywhere. It's not just to a specific area, but in these areas is where it's more common and you can find it more. And it would be Asia, South America, and the Caribbeans. In 2016, most death that has been recorded for chronic hepatitis occurred in China, Japan, and Vietnam. So that's the places that in 2016 that reports of high case death from hepatitis B was recorded. And then this is just going to be like new information on the microbe itself. So the age-adjusted hepatitis B-related mortality rate decreased from 0.46 per 100,000 U.S. population in 2017 to 0.43 in 2018, which is below the 2018 target rate of which is below the 2018 rate target of 0.45. So they didn't meet the target that they wanted to meet. And then at the end of 2025, they have set another goal of 14% from the 2018 rate. So they want to get 14% from the 2018 rate is needed to meet, is needed to be met, which is 0.35 death per 100,000 people. 100,000 people. And I kind of showed like a little graph that shows the death rate, the mortality rate from hepatitis from CDC from 2013 up until like what they expect 2023 to look like. So they expect it to go down. You kind of see a surge in 2018 where it's like 0.46, but then it goes down in 2018. So it's like it's going down. The death rate's going down. And this is my works cited. I try to put every information that I got online and used. And thank you for listening to my video.